Performance on the issues that affect children, and found that while some progress has been made, there is still room for improvement in many areas. Joining us now with more on this is the CEO of the Children's Rights Alliance, Tanya Ward. Good morning, Tanya.
Good morning, Tanya. Welcome again.
I think if you're going to look at any raft of government services, the chances are you would say, OK, but a lot of room for improvement. In the overall scheme of things, you've given them a C.
That's right.
Which is satisfactory, but significant scope for improvement, I think, would be the addendum to that. So what are the areas where you think that they're doing OK, and what are the areas that you think that really need to be looked at urgently?
Well, funnily enough, the government is doing quite well on the big reform issues. So in education, actually, the Department of Education has gotten its best grade so far. And that's because, let's say, in the area of child literacy, we've seen big improvements. There was a national literacy strategy introduced for children, and the OECD did a survey of child literacy in 2009 and 2013, and there was a good improvement in literacy levels.
How much of this do you think has been driven by the current minister?
I think a good deal has been driven by the current ministers as well, but also we actually have quite a good programme for government for children as well. You have to accept that as well. I mean, the other good areas, I suppose, for where the Department, let's say, of Children and Youth Affairs is doing very well is around, and there's a new Child and Family Agency. That's been critical because we have 17 official reports documenting how we fail children, particularly in the child protection system. The agency is actually part of that equation. We don't give the agency an A, you'll see that in the report, and I suppose what comes our main concern in relation to the agency is that it won't have enough resources going forward. We also want to see public health nurses going into the agency and psychological services for children as well, and that hasn't happened.
But overall, the agency is a step in the right direction.
It is a step in the right direction. It has lots of other services that are critical for supporting children and families in Ireland, including the HSC, the Education Welfare Board, domestic violence services. So it's quite broad in terms of the different agencies that it has under one roof, and it's actually been quite critical because a lot of the reports were showing that you might have a family with a lot of different problems going on. They're dealing with something like 11 different agencies.
Which is insane.
Insane, yeah. Exactly. And no information exchange. And a lot of the children in care will tell you that they just got sick of having to tell each agency a new story about themselves. So the idea with one agency is that you only have to tell your story once and they should be able to meet your needs.
OK, well now, in a properly functioning modern democracy, that's exactly what we would expect. In fact, we might quite rightly expect higher than a C overall. Where are the areas that you're particularly concerned?
Well, I suppose there are lots of children who are being left out in the cold. I mean, one of the biggest falls would be in the area of mental health for children. The government's grade goes down, they get an E this year, and that's because they committed in the programme for government to spend 35 million on mental health, and in this year's budget it's only 20 million. And what we've seen since last year is an increase in the number of children and young people looking for mental health services, like a twofold increase since last year in terms of the waiting lists. The other thing actually we're very concerned about is 68 children were being accommodated in adult psychiatric units, and children have a right to be cared for in a child's youth-centred hospital, but unfortunately there's a large number of children that are in adult.
Apart from the fact that the treatments for children would be completely different to the treatments required for adults.
That's
so
true.
That's just inappropriate on a whole range of
exactly, yeah. You know, I mean, it's frightening enough having to go into hospital for a mental health issue, and then you're there with lots of adults. You know, I mean, if you look at it from the young person's point of view, it's just not an acceptable way to provide the service.
And how do we fare if we hold ourselves up against the UK or France or other European countries? I mean, especially in particular in relation to mental health when it comes to children.
Well, I mean, a lot of countries don't do very well in terms of mental health for children.
So is it attitudinal then? I'm wondering, like, is it a societal thing that we just don't address it as an issue?
Well, I think mental health has been the Cinderella of the health system in any case. I mean, one of the reasons why, let's say, mental health isn't getting the resourcing that it needs is because the HSC has a legal obligation to balance its budget. So you have a hospital overrun, which continually happens. Money is clawed from mental health and put into hospitals. That's one of the reasons why we have a gap at the moment. But one of the areas where we're actually faring badly in contrast to other countries is in the area of child poverty. So you know, it's one of those areas where nothing has really changed.
When you say child poverty, define child. What do you mean by that?
Well, so 1 in 11 children is living in consistent poverty. That means they're going to school several times.
1 in 11?
Yeah, 1 in 11. They're going to school hungry several times a week. They don't have a new coat for winter. It's those very basic things. They don't get to go to the cinema like normal children. But at the very basic level, children are going to school hungry.
So that's like food, shelter, the basics.
The very basics.
So 1 in 11 children are not receiving enough food or enough clothes to keep them warm.
And it's really interferes with their ability to study and education, and obviously a child is developing. Absolutely, and a child is developing in their early years as well. So food is critical. But I suppose one of the problems in Ireland is that a lot of the work has been put onto the Department of Social Protection, and really what we need is a government-wide response to address the crisis in
Tanya,
when you poverty.
We don't have that much time left, but very quickly, when you present a report like this to the government, the reaction can be a whole variety of things. In some cases, it could be battening down the hatches and a siege mentality. They draw the wagons around, or do they go, "Okay, thank you for pointing that out. We will actually try and do better." Now, I mean, you would think from a PR point of view they'd say that, but what's your sense of how they view it?
Well, to be honest, we've had very good engagements with all the departments and all these different issues, and to be fair, they do want to do a better job. I mean, I have to be upfront about that. I think what happens is, in the big mix of things, resources, competing interests, all of those impact on all the different government departments who are trying to deliver for children. So I suppose we're out there trying to flag up good practice, because you want to give credit where credit is due, and then flag up areas where they need to improve.
You get the feeling that Frances Fitzgerald sometimes is playing a very lonely furrow at Cabinet?
I think she's championed children at Cabinet, and that's incredibly important. One of the things where we think there is a gap is we don't think anyone is really championing migrant children and traveller children. There are other areas where there really hasn't been any improvement. So we need to see someone like Frances Fitzgerald championing those groups of children as well.
The fact of this day and age, we're a first world country with 1 in 11 children going to school hungry and cold is just unacceptable. Tanya, thank you very much.
Thanks.